Welcome to the Healing Space Live and Online Chats with Roxanne and Rhonda. This podcast will share information on self-love, living a wellness-filled life, having healthy relationships, how to avoid unhealthy relationships, how to heal from traumatic events, and more. If this is your first time joining us, we welcome you and we hope this will not be your last. Enjoy the show. Hey, y'all. Welcome to another episode of Healing Space Live and Online Chats with Roxanne and Rhonda. I am so excited about today's episode, which we call Movember, formerly November, is for men's health, that is. And so when Rhonda mentioned about talking about men's health, I was so excited because I love the fact that men are starting to take ownership of their health. I know there's an issue where there's still some who won't go to the doctor and this, that, and the other, but I really appreciate that they're starting to do this. And I love that we're talking about it. And I got a lot of feedback from posts that when I let people know about it, people were saying, thank you. I'm glad you're talking about this. So with that, I'm going to read the bio. We're going to read the bios of our guests who are well, I don't have one bio. I guess he'll just have to tell us who he is himself. So we have Dr. John Murphy, Mario Browne, soon to be Dr. Mario Browne, and Dr. Devin L. Patterson. So I'm going to read Mario's bio, and then Rhonda will read Dr. Murphy's, and Dr. Devin will just give us a brief overview of himself. So Mario Browne is the inaugural Associate Dean for Equity, Engagement, and Justice in the School of Pharmacy at the University of Pittsburgh. He is the immediate past director of the Office of Health Sciences, Diversity, Equity, and Inclusion at the University of Pittsburgh School of Health Sciences. Mario holds a BS in Biology and a BS in Medical Technology from Salem International University and an MPH from the University of Pittsburgh's Graduate School of Public Health, and currently pursuing his Doctor of Education in Administrative and Policy Studies at Pitt School of Education. He is a member of the Delta Omega Honor Society for Public Health Excellence, an alumnus of the Emerging Leaders in Public Health Scholars Program at UNC Chapel Hill, and the Minority Training Program in Cancer Control Research at UCLA. He served as Public Health Administrator for the Allegheny County Health Department's Bureau of Epidemiology and Biostatistics, responsible for managing county-wide public health promotion/disease prevention programs. Prior to that, Mario served as Project Director and Community Health Coordinator for the University of Pittsburgh Center for Minority Health, now known as the Center for Health Equity. He is a trained intergroup dialogue facilitator and certified emotional emancipation circle facilitator. Mr. Browne serves on various community and professional boards and committees, including the Pennsylvania Department of Health Equity Task Force, and is the co-chair of the Community Research Advisory Board, also known as CRAB, at Pitt's School of Public Health. I thank you for joining us, Mr. Dr. Browne.
Having me.
Okay, Rhonda.
Good evening, everyone. And along with Roxanne, it is my pleasure to welcome our guests. And of course, as always, to anyone who is in our listening audiences this evening, this afternoon, this morning, or whenever you may decide to catch this, wherever you catch podcasts. Introducing John L. Murphy. John is presently a behavioral scientist who works for the federal government, utilizing various large extant data sets to answer relevant programmatic questions and publish the findings in research journals. Specifically, the psychological factors that influence microeconomic decisions. He holds a master's in public health and a Ph.D. in social work from the University of Pittsburgh. He began his career as an Army military officer. His first military assignments included serving as the Assistant Chief of Behavioral Science and professor of behavioral science in the Martin Army Hospital Family Practice Residency Program. Following his military service, he served in the District of Columbia's Child and Family Services Agency, CFSA, as program manager for the Office of Planning and Policy Program Support. In this role, he oversaw the development or realignment of new and existing agency policy. He was also the primary investigator of the District of Columbia's first comprehensive Okay. Well, all that will go wrong. Okay, here we go. Comprehensive evaluation of the needs of children in care. He orchestrated the process of conceptualizing, constructing, and implementing the assessment, which would be used to inform the agency of programmatic deficiencies. The needs assessment garnered national attention and becomes a model in evaluation of need among child welfare agencies. He has served as an assistant professor at Wayne State University, and I might interject where I went to observe him, excellent professor, in Detroit, Michigan, and as an adjunct at the George Washington University, the University of Maryland. Welcome, Dr. Murphy.
It's a pleasure to be here.
And so to save face for Dr. Patterson, I am going to just say that there was some mix-up. Technology, as we have seen this evening, technology is what it is. And Dr. Patterson definitely would have sent his bio and all of his information if he knew before 5:30 today that we were still expecting him to be a guest on the show this evening. So I will say that Devin is a very dedicated man to his work. He is very passionate about his work. As he mentioned earlier when we were talking offline, he started working at Women's Center and Shelter. And I will tell you all, and it may sound vain, but it's true. Devin was my go-to. If I couldn't go to a school program, if I couldn't do a training, I trusted Devin to go. And we had 7 people to choose from, and I had one who I went to consistently. So again, welcome, John, welcome, Devin, welcome, Mario. Glad to have you all here this evening. And
Great
with that, thank you. And with that, I will go on and just get started so we can kick off this Movember session that we're having here. So I'm going to ask if you each can respond to, and I'll ask you by name so we don't jump over who's going to speak first. But can you each respond to the possibility of the impact of a man's neglect of his physical health in relationship to his mental health? So when a man particularly, because this is about Movember and about men, so when a man specifically is neglectful of his physical health, how might that impact his mental health? Mario, how about we start with you, please?
And again, thanks for having me. And by the way, we were talking offline about Rhonda being a mentor. She was also a mentor to me. She introduced me to this whole concept of abuse, and even coached me to do some groups. And I learned a lot in that process, Rhonda. So I wanted to thank you for that. I learned a lot about myself and about other men. And so to that question there, it's interesting that you asked that, because I was just saying to myself recently, when you look good, you feel good. And I say that because I just came from the barbershop, and anybody that knows me knows that I hang out in barbershops. I like to use barbershops. Dr. Murphy and Dr. Patterson, I like to use barbershops as health promotion sites and turn them into places where people can actually get, especially men, can get accurate health information, can meet some health professionals that they can trust, and that they can talk about anything that they want to talk about. And as Roxanne and Ron may know, at one point I even had nurses coming into barbershops doing prostate-specific antigen tests and DREs in the barbershop. Now just picture that for a minute, right? But it was all about trust. And I think with men, we put up walls and barriers because we often operate off this whole hyper masculinity thing, and quite frankly, I'll speak for myself. I was socialized that way. If I'm playing sports, I can't be hurt. You fall down, you cut yourself, you can't cry, you can't say that it hurts. You just keep on going on. And those were all lies that were told. And as a result, it took me a long time to realize that I needed to go to the doctor on a regular basis. I needed to get physical checkups. And then when things began to happen, when chronic illness began to kick in, I'm actually dealing with osteoarthritis right now. As a matter of fact, on January 2nd, I'm getting my second knee replacement. And I can tell you that when my health is bad, I don't feel bad. I don't feel well, rather. But I do want to go right back to where I started at in terms of how it affects a man's psyche and how it affects my psyche specifically, is that if I am under the weather or I don't have the mobility that I usually have or that I'm used to having, it actually depresses me. It makes me feel low about myself. It makes me feel as though I can't do the things that I feel that I'm responsible for and responsible to do. And so I think that the best thing that I can do is try to prevent some of those things from happening. So therefore, I need to take care of myself. And when I say take care of myself, I really mean basic things such as eating decent. I'm not talking about being perfect in eating, because we just came out of Thanksgiving. I can tell you that I didn't eat healthy. I ate bad, and I ate a lot of bad. But to do something for my physical health, such as walking or riding a bicycle, right? And then making sure I get proper rest, not trying to burn the candle at both ends all the time. And so I really believe that if I do not take care of my physical health, it'll begin to show. I'll look in the mirror and I won't like what I see. And contrary to popular belief, men do care about their body image. We care about how we look, And so if I'm looking good, I'm feeling good. And if I'm feeling well, I'm thinking clear, and I can do the things that I need to do to take care of me. So I'll pass the mic on that.
Thank you, Mario, and thank you for sharing and making it personal. Really appreciate that. Devin, you want to follow up?
Yeah, and actually, Brother Mario hit on most of what I would say, but I would add a very important piece when he talked about taking care of your body and sleeping. Sleep is so important. They use that is used as a torture technique by the military. They know that sleep deprivation, what it does to the psyche and to the body's ability to function at optimal capacity. They know the science of that. And so when our bodies are not in good shape, when we're anxious, when we're hyper, when we've had too much caffeine and so we can't sleep and our body's dysregulated, that causes us to not function optimally. And so with the lack of sleep, you're not going to be as alert. You're going to be drowsy. You're going to be moody. You're going to be agitated. You're going to be irritable. And research shows that those things contribute to stress. Anytime, and we know the impact that stress has on the body long term. As African Americans, we grew up in stress. There's research that's talking about, intergenerational trauma. In other words, stress and trauma that was passed down from our ancestors. And so we're accustomed to stress. But the negative side is that for us, the research is telling us now that could potentially shave years off of our lives. Us living so stressful, being sleep deprived, and not taking care of our bodies, that we can lose 5 to 10 years of our life on things that we know are what they call preventable, things that we know that we don't have to allow those things to happen. We can prevent them from happening.
Thank you so much. And John.
First of all, let me just say it's really hard to come behind two very smart brothers. there's not a lot left to talk about. but I want to underline a lot of what has been said. Everything that's been said. In fact, there's a lot of a man's self-esteem is so intricately tied to his sense of well-being, his sense of physical prowess, and when that's affected, you do get things like depression. You do see mood disorders. You do see reduced self-esteem, as was talked about earlier, as well as increased stress. You also see cognitive decline. Poor physical health can lead to cardiovascular disease, which of course can impair blood flow and to the brain, and can lead to cognitive decline. Sleep disturbance has already been mentioned, and increased risk of substance abuse. People, self-medicate because they have some self-esteem that's been affected by their physical or mental health. And the last thing I'll just touch on is social isolation.
Oh no, he froze. You're back. You froze for a second, John.
Oh, I'm sorry. Okay. Well, the last I think I was trying to end on that there was a sense of social isolation that also results from physical health problems and a person's ability to participate in physical or social activities. If when you're not feeling all that well, you don't want to be social, or may hurt to be out and about. So it has a limiting effect on your social life, your social ability, which of course adds to your depression and stress and things of that sort.
Mm-hmm. Yeah.
Wow. I just wanted, before I ask my question, I'll just say this applies to women and men. Because I'm sitting there listening to you and I'm like, okay, I'm gonna get it together. Because I don't eat well, I don't sleep. I've been sleep deprived for the past 2 weeks. I took a nap today, something I very rarely do because I just don't. So, oh my goodness. All right, I'm listening, doctors. So now we want to know, so it's been said that Black or African American men are reluctant to go to the doctor because of its implied weakness. And we wanted to know if you thought this was the whole story, or is there something else to that statement? Anybody could jump in. Since I see your face, Devin, you go first.
Okay.
I don't know why, but your face is there. Yeah.
No, I'll and what I'm gonna do is I'm gonna try to just give a little so I can leave some for my good brothers. I'm gonna just give it a little. I ain't gonna try to go all out. But
Okay.
but when it comes to that, it's what I like to call I call it the James Brown syndrome. One of James Brown's songs was "I Feel Good," right? And so as African Americans, we have always been taught, well, if I feel okay, then nothing's wrong. So think about it. When you were a kid, boy, nothing wrong with you. Take your butt to school. When you played sports, you got a whole nother knee. Go use that one. Go get back out there. So for us, if we can't feel the pain or we can't see the injury, if we feel okay, then for us, there's no reason, no cause to go and get checked out. And again, to me, like I said, I call it that James Brown thing, and that for us is like, well, because you always will hear people say, well, I feel fine, I feel okay. Meanwhile, looking behind the scenes is something that's unseen that's creeping up on us. And so that plays a huge part in why African American men don't get examined, because it's like, I feel okay. I don't feel sick. I feel okay.
Wow. Dr.
Let my brother John go, because he had to go last time.
Okay.
Appreciate you, good man. I guess what I would contribute to that is, no, it's not the final story. It's a piece of the puzzle, for sure, but it's not all that there is to know. I think a lot of it has to do with representation. And, we know that there's a lot of studies that show that Black women don't get serviced well by majority providers. They're best served by, providers of color. And to some degree that's true for men as well. There's a factor of trust in non-Brown providers. We often don't feel heard by, some providers, by some majority providers. And of course, there's a historical distrust that we have. I mean, we all know about Tuskegee. Mm-hmm. We all know about Henrietta Lacks, and the name Marion Sim has gotten a lot of attention in the last few years. I was going to say gentleman, but the individual who would operate on Black women without anesthesia to test surgeries that he would later perform on white women with anesthesia. So there's a considerable amount of distrust, in the community as well. So,
yeah, absolutely, and I would build right off of that what John said. Part of it, I'm gonna go back to what I said about socialization as well. That we are sort of socialized, out of the health care system. Always would think about as teenagers, young men, the way that we would often go to the doctor to get our checkups would be because we had to get a checkup in order to go to school the next fall or to participate in some type of extracurricular activity. Meanwhile, young ladies were being socialized to go to the doctor for their own health and care. And so once we graduated from high school, or maybe some of us played some ball in college or something, and we had to get physicals. But after that, mom stopped taking us to the doctor or having to sign off on our notes for us to be able to do whatever activity, right? Mm-hmm. And so we thought that was the end of it. As Devin said, why do I need to go to the doctor? My eyeball is not hanging out, or even if it is hanging out, it's still working. Right. So why should I go to the doctor? All they're going to do is cause me pain and harm, and so I think the trust is definitely part of it. I think access is another thing. I'm just going to speak for Pittsburgh. John touched on a really important part in terms of representation. If I want to see a Black male physician, primary care physician, I'll be hard pressed to find one. That's right. The other part is that in some urban areas where Black men typically live at, for instance, Pittsburgh, there was a report that came out and it really highlighted gender and race. And it really, a lot of the spotlight was shined on Black women and how Pittsburgh is the worst place in the country for Black women to live. Well, if you look at what it said about Black men, it's not too great of a place for Black men to live either. The poverty level is high. We do not have good paying jobs. And so therefore benefits, everyone doesn't have the benefits that they need to be able to access services. And so sometimes with that trust thing, you got to be able to bring the health professions to the people where they're at, via churches or wherever it may be. So part of it, I think, is definitely socialization. A great deal of it has to do with trust. And another portion of it definitely has to do with access. And some of it also has to do with we don't know what we don't know. So if I've never really been taught about what I should be doing at certain stages of my life, and something that John had said in the first question that Rhonda posed, he talked about the life course. And I don't know if men really look at our health in a life course. We tend to look at it episodically, right? Yep. But we don't really look at it through a life course lens. And so these are things that we have to unlearn stuff and then relearn stuff, which is why what you're doing with this podcast, I think, is so critical.
Mm-hmm. Well, my father has passed on, but I wish he was here to tell us why, if he had a hangnail, he was going to the doctor. So I'm exaggerating, but he had no problems going to the doctor. And I really wish I could have, had spoken to him about this and what helped him go through that or be able to do that. Okay, Miss Rhonda.
Speak about your dad, because it is rare. And you all are really making me just think so much. And I'm just, my daughter's father, who is now deceased, but I remember he would not go to a doctor. And this question really makes me think of him. For him, he really did say that it's a sign of weakness. You didn't go to the doctor, right? Mm-hmm. And then I remember one time when he was in the hospital. By then, he and I weren't together as a couple at this point. But I remember when he had like an abscess or something on his tooth that burst in his mouth, and the fluids went down. He could almost die. He came in inches of death because a man don't go to the doctor. And consequently, he passed away from prostate cancer years ago. And I often thought about the fact that had he maybe not had that manliness about him and would have gone to doctors more often, that maybe he would have found out about cancer even sooner. Who knows? We'll never know. But you all are really touching on a whole lot, and I'm really so grateful for you all being here. I really am, for this evening. So noting that you're not a medical doctor, so we're not asking for a medical opinion at this point. But you all do have one thing in common. You're all African American men. And the other thing you have in common, you're all past your 30s and 40s.
Watch your mouth, Rhonda. Watch your mouth.
Y'all told it all by saying how long you know me. So I'm just wondering if you all could just share some insight on maybe just like men. What should they do maybe in their 30s? What should they do in their 40s and 50s or beyond? And you don't have to be real specific, but what are just some thoughts? And Dr. Murphy, we're going to start with you. What are some thoughts around, what are some checkups men need to get? Because as Mario said, if you're not signing, or Devin, I'm sorry, if you're not signing off on them for the school, to be on the school athletic team, you don't have any reason to go when you're 31 to the doctor, when you're 42, or do you? So with that, I'll give it to Dr. Murphy.
Thank you, Rhonda. Thank you. I guess I'd say the first thing for someone in their 30s is a good general physical exam on a regular basis. Annual checkup that's going to get you, a reading on your blood pressure, maybe body mass index, sort of things. I just saw, and I guess this is on my mind because I saw recently an X-ray of a gentleman's lungs, and he had cancer that had just metastasized all over his lungs. Needless to say, the prognosis was not very good, but it started, and I would have never made this connection, but it started, according to his physician, it started as testicular cancer, which could have been, caught earlier if he had regular general physical exams. But by the time he started to cough from the metastasis in his lung, we're talking about stage 4, stage 5 cancer. So, a good general physical exam when you're young, and that's the time when you think that you're indestructible. I know that I did. At that time, I could jump off a building and bam, and just get up and just brush it right off. I'm 50s now, and I got my orthopedics on speed dial. So it don't work quite the same anymore. So anyway, so that's what I would recommend to our brothers in their 30s.
Thank you.
I think you're up, Browne.
Okay, yep, I'll jump in. So yeah, absolutely. Yeah, we talked about the life course thing. Knowing what to get at what age, I think is sort of it's definitely not sort of, it's very important. And it does start with having a medical home, I think, and one of the ways that you continue to go back every year to get your physical or get your annual is if you have a medical home, you have a primary care doctor, and so that's really important, is making sure you have a primary care doctor who can then sort of play quarterback, to use a sports analogy, to be your quarterback of your health, right? Tell you what you should be getting done at different times. John, I'm 62, and I remember getting my first colonoscopy that test. All
Yeah.
right.
Yes, yes, sir. Yes, sir.
Yeah,
The one we all
at
love.
50. Right,
Yes,
right,
sir.
exactly.
Yes, sir.
Yeah.
Yes,
I
sir.
can't even say it. That's that's how
Hey, brother,
traumatic that
you
is,
don't.
right?
Hey,
We all know
for those
about
who
that.
understand, you don't have to say it. For those who understand, you don't have to say it.
It's understood.
with you.
That's
I
right.
already
That's
know.
right.
It's
Yeah.
understood.
Yeah. So, and getting that at 50 and then being told when I would have to get the next one. No, and these things. The same thing with vaccines. I thought that as a young man, there were certain vaccines we got as kids. I'm old school. I have the mark on my shoulder from when I got my vaccinations, right? And then there were other things that were sort of not obligatory, but you can choose to get them, such as the flu vaccine and things like that. But then as you get older, there are certain things that your doctor begins to tell you, no, you should get this. You should get a shingles vaccine. You should get different things. And I know that there's, a lot of controversy around vaccinations. Being a public health guy like you are, John, I'm like, no, I think vaccines, just like seatbelts, help save lives. So I'm an advocate for vaccines. But there are certain tests that you need to get throughout the life course. So prostate examinations, we're talking about men's health,
Right.
so colon, you should definitely be paying attention to your heart as you begin to age. My oldest son is 36 years old, and I'm proud of him because he is paying attention to his health. He knows that he should go to the doctor. And as Rhonda said, isn't just the doctor or the primary care physician you should go see, but you need to go see about your teeth. We know that heart disease,
Come on.
cardiovascular disease, all these things can be affected through what happens, as Rhonda already indicated, what happens in the mouth. The mouth is sort of a gateway to everything, right? All the germs and everything else. So it's really important to also see a doctor and a dentist. And I'm going to share this and pass it on to Dr. Patterson. And that is that I often do this exercise with health profession students. We call it a sort of across the line. It's really a privilege exercise. But there's one question where I often ask, who has gone to a doctor and a dentist in the past year? And to my surprise, most of them, and a lot of these kids are sort of come from privileged backgrounds, but most of them have not seen a doctor and a dentist in the same 12-month period. And because the dentist oftentimes is the person you go see when you have a problem, but you really want to see the dentist before you have a problem. Right? So I think it's really important that we get a medical home, somebody that can sort of clock us and tell us when we should go get certain things done and stay on top of that along with us, not for us.
Thank you. Devin?
Okay. Again, I think all of those milestones, 30s, 40s, and 50s, African American males particularly need to be paying attention to their health, especially since we have a predisposition based upon our family history. And on that part, I think we as the elders, or we have an obligation to share and encourage and talk to our children and grandchildren about the importance of their health. Because again, hereditary, a lot of those things are going to be passed down to them. I mean, two out of every five African Americans have high blood pressure. As you mentioned, your ex Rhonda died from prostate cancer. African American males have, I think it's 75% greater risk of receiving or having prostate cancer than Hispanics or non-whites. And so again, we're in the high risk category for all of these health issues, and yet we continue to might as well say roll the dice and not take our health as serious. And we still continue to live shorter lives than our wives and our counterparts. I mean, and a lot of it has to do with us not taking our health as seriously as we should. And so again, this, as it's already been said, this is such an important topic that our village, that we decide to speak out and support and encourage one another. Let's go and get healthy and go keep our health intact.
Wow.
Amen.
Wow. Thank you. Thank you. Thank you. Very good stuff. I'm really enjoying this conversation. And so we've been discussing this topic based on November being Movember, a month for men to grow mustaches and pay attention to serious health concerns and checkup needs. But on but Rhonda and I
grew mine last night, Roxanne. I just grew it this week.
did good. You did real good. That's funny. But most of you all know that we talk about relationships on our podcast, and we talk about all types of relationships, but my focus is really on healthy relationships. I'm really trying to encourage them and self-love and all that good stuff. But we wanted to know are you aware of any specific connections between physical health complications that might cause frictions in relationships, frictions or problems in relationships?
Oh, I think I get this one. I get the home run right here. So listen, high blood pressure, diabetes, they are contributing factors to ED or erectile dysfunction. So that is going to have a major impact, potentially have a major impact on a relationship. It's also is going to have a major impact on a man's psyche in terms of how he perceives himself and how his self-esteem about himself. And so that is a huge one that plays a major part in in a male's ability to be sexually active. If he's suffering from diabetes or high blood pressure, or if he's obese, those things will definitely get in the way of him having a healthy physical and emotional relationship.
Okay. Wow. Dr. Murphy, want to jump in?
No, because that was
I told you. I'm selling this. I'm turning my camera off. I'm unplugging stuff.
Okay.
Right. Like we gotta go home now. No, but I completely agree with that, and it is a very serious issue. I guess I would add, to some extent, there may be financial stresses that come from illnesses and such. Even if you have decent health insurance, I know I don't know about you guys, but my insurance is going to reset on January 1st, and so my deductible. So I'm going to get an MRI this Saturday because I don't want to have to pay for it on January 2nd when there's going to be a lot more money. I mean, those kind of financial strains can definitely put a hurt on a relationship. And this, unfortunately, is probably more likely to affect our sisters, but caregiver stress as well. A lot of us men, we're often dependent on women to help us as we age and so on and so forth, and that puts stress on our loved ones, and of course that puts stress on the relationship as a whole.
Wow.
Yeah, they just preached the sermon right there. I have nothing to add there. That was all that.
But that was some good stuff there. But Rhonda has.
I said, Mario just gonna say amen.
Okay.
That's what I said. Amen. But no, and really what Dr. Murphy just hit there too is even the financial strain or those roles that men often play for good or bad or indifferent, right? We started off talking about hypermasculinity and things like that, but there are roles that people play in relationships. And even to the extent that I may be required or expected to do some physical type of things around the house, around the home and outside of the home, that if I'm not up to speed physically, that could definitely have an effect on relationships, on my relationship, for sure.
Absolutely.
Those are all excellent responses. And we're winding down. So I want to say that so we all know, as well as for our listening audience to know, we are winding down. But I just want to ask this question for sure. It has often been a generalization that women or wives nag their men, their husbands, or their partners. Now, of course, that was a very heterosexual description I just gave. So we're just going to stick with it, but that women nag. And I'm just wondering if there's any thoughts of how a woman, a partner, could give some suggestion to their husband to really go take care of themselves and go to the doctor without it being perceived as you're getting on my nerves or you're nagging. And John, you really hit on a point when you talked about financially, because, you know, I could very well hear that being, didn't you just say yesterday you want me to get this, you want me to pay for this, you want me to pay for that, and now you're talking about go to the doctor. I don't have money to go to a doctor. You know, I could really hear that when you responded like that, right? So I'm just wondering, like, with some suggestions, how could you maybe hear it in a loving way? Or what are some suggestions? And maybe for any age group, but we talked about the 20-year-olds need to really get their checkup and their exam. You know, you're young, you're in a new marriage or new relationship, you're in your 30s, you get ready to think about fatherhood or whatever the case may be. And here your partner is saying, you really need to go to the dentist. You really need to get checked out. So what's a loving way somebody might be able to say that? Maria, John, I'm sorry, you were ready. You bear back. You were ready. Go.
So I would say that the first thing would be to empathize with him, and a lot of the things that we've talked about, to be sensitive to many of the issues that we talked about a man's virility and his sense of self-esteem and worth being so intimately tied to his physical well-being. Empathizing with that piece and understanding that piece will lead you to hopefully will lead you to be able to actively listen to what he's saying verbally and non-verbally. We as men, maybe I should speak just for me, but I know that I do a lot of communicating much more non-verbally than I do verbally when it comes to my health. I'll say a lot, but I'm not necessarily saying it with my vocal cords. And, sometimes the people around us need to be sort of in tune to those things that we're saying without saying. And, trying to be non-judgmental. When you do hear something that your partner, that he's telling you, be non-judgmental about that. Have an open mind about it, and sort of meet him where he is.
Yeah. Thank you so much. Mario?
Yeah, I was just sitting there thinking, of course, I had to, think about my wife when you said, I think I've said that to her before, about why you nagging me, why you, but thank goodness that she does that, right? That she, if I'm complaining too much about something, at some point, she's just going to look at me real crazy and say, so when are you going to the doctor? Bottom line, when are you going to get that checked out? You've been complaining for a month now, and so, we know that even in the literature, in the academic literature, it talks about how women are a motivator for men to go to take care of their health and go to the doctor. There was even a big national campaign that Tom Joyner show did called getting women to take their husband or take their father or take their brother to the doctor day, right? To really try to encourage men to go to the doctor. So, I think with what John said, definitely, having some empathy, doing it out of love, but I think it's also very personal. I know when I got my first knee replaced in 2014, I tell the world, thank God for my wife, because it had got kind of shaky there for a minute during my recovery period. I mean, she had to take care of me. And so when it came time to make a decision to get this other one, this second knee replaced, it was a family decision. My daughter still lives with us, and they both, as a matter of fact, I postponed it twice because their schedules didn't fit with when I was looking at getting it done, because I was going to need them to help take care of me. I need them now, right?
Mm-hmm.
And as I age, I know, as I think John's already alluded to, I need them, and I need my wife more than ever, because I'm just not the man I used to be. All right. But yeah. So I do think that there's a way to do it without being overbearing. But sometimes we actually need that kick in the butt to say, go ahead and do what you got to do. Yeah. Ultimately, women grow up and they become women. Us men, we stay little boys in some area, and we actually need mama to tell us, boy, go to the doctor,
You're not wrong. You're not wrong.
Not at all. Not at all.
Wow.
Now we and you guys have actually hit mostly everything, but I had and this wouldn't apply to everybody, but this was something that my wife and I did, and it was very, very helpful, at least to me initially when we, because I've been married 27 years. When we first got married, my wife and I had the same physician, and so us going to the doctor became kind of like a date. So we had the same physician.
Wow.
So, and that's why I
it.
said it wouldn't be applicable to everybody, but as husband and wife went to the same physician. So, we would, and it was sometimes we'd both be in there for each other's exam, but most of the times she would go in first and then I would follow. But it just made that something like that a lot easier, because when she would schedule the appointments, she'd actually be scheduling for both of us. And again, this was, we had actually asked for this to a physician who could actually treat both of us. So we both had to be comfortable with the person, and we found somebody that we were both comfortable with, and we probably did it probably for like 7 to 10, and it was great. It was great. It was a real fun thing to do, and like I said, everybody couldn't do it. But it was, if you're married, it's something to consider. And it was like a date night. So we go on our doctor's appointment. Afterwards we would go in. If it was a late appointment, we go and do breakfast. If it was a early appointment, we go and do lunch afterwards. But it was something great that we did as a couple.
I really love it. That's lovely. I love that.
Yeah, that's
me too. That's a good one.
That's beautiful.
Yeah.
So I was saying, we're coming to a close. So just some summary points I just want to make. I got to start with, first of all, just saying thank you, and thank you. This has been an over the top. Roxanne and I often talk about, remember that podcast? Yeah, that was my favorite. No, this is my favorite. This is my favorite. It's my new favorite for sure. So it's been excellent. I also don't want to fail to mention that Devin, Dr. Patterson, is a return guest. So he and another therapist was a guest not too long ago. So you can look that up on the podcast as well. But we started out with you all reminding us that men are socialized not to cry. If you fall down, get up. If your left knee hurts, use your right knee. Get back out there. Talked about how this can lead up to social isolation, depression, and mood swings. And I like the fact that you all address both self-esteem and self-image, because we don't think about men caring enough about, or that they care about how they look, and tying that into how they feel and the overall impact on their moods and how they may act accordingly. So I thought that was really good. I gotta say in summary that you brought up Brother James Browne, that I feel good, right? So he said, I feel good. And long as the thought though was really like, as long as I feel good, I'm not bleeding, there's no real major any dysfunction, like, I don't need to go to a doctor. So thought that was really good to bring up also. Thank you also for mentioning the distrust that African American that we have over the system. It's not new. John brought up the historical ones, and it's not really new, but we are even talking more about the disparities in the healthcare. Mario, I know you were on a I don't know if it was a research study or some work back when Dr. Angela Ford was in Pittsburgh. Remember that work as well?
Yes.
So just talking about the health disparities now. Women, mothers, do I want to take my child to this doctor, particularly if I can't find one? And in Pittsburgh, I'm going to tell you, finding a Black dermatologist, it's like they say a needle in a haystack. there's no needle. It's not even a needle in the haystack, right? So those are that distrust can be is real. It's reality based, right? I love the fact that you mentioned have a PCP as your quarterback, right? Get your quarterback. Have that person out there encouraging you to go do what you need to do and go get that physical exam in your 30s. You are not too young or too old to do it. It's real, and you need it as well as you need to see a dentist because that I love the fact that you said that is the gateway to a lot of germs. Yeah. So I've said thank you. So my final is just to say that I knew you all were smart. I knew you were all academically intelligent, but I got to go to two more things. You're brilliant, and y'all was excellent eye candy for the night. So I'm gonna make sure we get a lot of people to watch this episode. Thank you again.
So I too want to thank you. And I have enjoyed this immensely. I've learned some things. Like I said, I'm gonna start taking care of my own health as well. So this replay will be for those who missed it. We will be replaying it again, and you can listen to these previous episodes on our website. Now I'm going to say the name of it, but I will be sharing the link because it's just too much. You might not remember it, but it's Healing Space Live and Online Chats with Roxanne and Rhonda. That part's easy. .buzzsprout.com. So it's buzzsprout.com with the name of the podcast in front of it. And there you can check out all the podcasts that we've done over the past 3 years. And but Rhonda and I get so tickled when they show us our statistics. So we're still new at this. We're still learning, right? And they show us, there's people listening to our podcast in parts of the world I never even heard of. I'm like, what?
Oh, wow. It
might be only like one or two, but whatever. I'm like, how is that happening? So that's that's really exciting. I'm really excited about that. And you can also watch this podcast on our YouTube channel. So I will be when I post this, and I'll go ahead and apologize now for this was supposed to be live, and we were having technical difficulties like we had last month, but this was a different type of oh, well, whatever. So we just recorded it, and on there I will have our YouTube channel link as well, so that you can watch it. I know some people tell me, I ain't got time to be watching no podcasts. A lot of people like to listen to it while they're riding. So we're on almost every platform you can think of for listening. But that's it. And like I said, I'll post this up on on Facebook to let you know when it's our next one is going to be. And until next time, we thank you very much and have a blessed day. Good night.
Can I squeeze one more thing in?
Of course you can.
Okay, I just have to say to everybody watching this, I got to give shout out to the D9 because you got 4 organizations represented right here. So I just had to say that.
Oh, wow.
Yeah. and
roll call.
I want to say something too. I'm sorry. I want to apologize. I didn't get it. Heaven, are you still there?
Yes, I'm here.
Well, look, can we see your face?
Yes, you can.
I just wanted to let everybody know this is Heaven Davenport. She's our intern for Carlow University, and I just wanted to say hi. She's in the background helping me out, and we're learning together. I bet you next month when we have our live, it's going to be live. We're going to make this thing work. We did live last month for the first time, and we thought that it went, once we got through the technical difficulties, it went very well. And Rhonda and I decided we should continue doing that, but it didn't work this time, but we're going to make it work next time. Okay.
Roxanne, Rhonda.
Pardon me?
I really enjoyed this podcast because now I'm taking a course in Carlow because I'm majoring in psychology with a concentration of counseling, and I'm actually taking men and boys studies. So this was really good.
Wow. Look at God. Look at God. I love it. I love it. Okay. All right. So anything else before we say good night?
Well, I just want to say, Roxanne, Rhonda, and Heaven, thanks for having this platform and for inviting the brothers on.
Yes.
Oh, for sure.
Really appreciate it.
And I forgot to say that the website for Movember is us.movember.org, I think. I put it in the chat. Let me see. Let me just make sure I have it correct. Because, and then I meant to ask you guys, do you know of any other resources that people could to check out? But I really like this. It has a lot of stuff on there. Well, of course. Now, where is it? Now, I did put it in the chat, and guess what? It's gone. I'm telling you, this technology today is just horrendous. Even we couldn't even hear Rhonda at the beginning, and then all of a sudden she's beautiful. We can hear her clearly. So, but anyway, I'll put that on the website, on the post as well, so people can know to go check that out. Our podcast and the Movember, because there's a whole lot of resources on there for men. I mean, they had some stuff on there. I'm like, oh, I never thought about that because I'm not a male. But when you go on there, you'll see.
Here you go, Maria. Thank you.
What's that? Oh, awarenessdays.com. All right, cool beans.
Oh,
So
nice.
we'll make sure people know about that as well.
Nice.
I do have one parting question for
Okay.
you, Roxanne. So Movember, Men's Health Awareness, and we have to grow a mustache. So tell me about what month is Women's Health Awareness, and what is it that you all have to do?
Women's health awareness is 365.
Okay, all right.
Like you said, they started grooming us when we was young to go to the gynae. You know, we hated
John
it.
and Devin, I knew I was taking a risk by asking.
Yeah, brother. I was like, tread lightly, bro. I'm not gonna help you. Tread lightly.
Yeah, every day is our day. But I really, really appreciate you. And don't be surprised if you'll be asked to come back and talk about something. If we hear about something specifically we need the brothers to know about, we will be calling on you guys.
Love to be
Thanks
back.
so much.
Sounds good.
Okay.
That sounds good.
Okay, guys. Thank you so much.
For your patience. We went longer than usual, but thank you for that. Good night, all.
Good night.
Good night. Bye-bye.
Once again, we want to thank you for joining us today. We hope that you heard something which will stick on your mind this week. And even more, we hope that you will find someone to share the message with. We have one request. Please engage with us. Follow us and like and subscribe to all of our social media platforms. We're at warheels_ on Instagram, LinkedIn, and Twitter. Spelled out, that is WAARHEALS_ And on Facebook, you'll find us at War Heals. Please plan to join us next time. And in the meantime, you can find all of our episodes archived wherever you listen to podcasts. See you next time on Healing Space Live and Online. Chats with Roxanne and Rhonda.